Vancouver's a melting pot of many societies and many ethnicities, and we do see people from various parts of the world who may have aesthetically imbalanced large noses. And the aspect of the nose, it can be bigger, it can be the upper third of the nose, which is bone, the lower two-thirds, which is cartilage, and maybe some flaring of the nostrils down here. And so we examine the patients, and you have to be very clear with people who have a somewhat larger nose, because if you're making a large nose smaller, you're probably going to impact the airway somewhat. And we do not want to impact the airway in a negative fashion, so a careful examination is performed. And then, after computer imaging the patient, we get an idea of what they may like. And in a lot of these patients, we'll also get them to bring in 3 photographs of noses and faces that they like, and 3 that they don't like, so you get a clearer understanding from the patient what they're really afraid of and what they'd like to achieve. And after you've done that, we alter the bony structure, typically making it somewhat smaller. We can alter the cartilage, again, to make it somewhat smaller. And there's techniques that we can use to enhance the airway to make sure that they're not going to get a compromised airway. And after we've changed the structure, the skin will typically naturally shrink wrap around the new skeleton. It may take 1 or 2 or 3 years for it to do that. And we call this the blue plate special go big or go home rhinoplasty, because these can be life-altering surgeries for these people who may have had some ridicule or friends would comment about their large noses. We put them into better aesthetic balance, and it's surprising how few relatives or friends of these patients will notice that something has changed in their nose. But these are life-altering surgeries that can make the patient so incredibly happy. And it's great to be a surgeon in those circumstances.